Welcome to the Truckers Podcast, ladies and gentlemen. I'm your host, Doug, from Ontario, Canada. It is 10:01 p.m. here on January the 10th. And tonight we're going to talk about back to school starting the 17th of this month here in Ontario, Canada. And hopefully they get this right. Thank you for joining me. Thank you for coming out here and joining me this evening. I'm actually really surprised, the government to make this announcement, the Ontario government to make this announcement today. The federal government and the provincial government, they had like a Zoom meeting today, and should be surprised. I mean, we've had special interest groups, parent groups, pediatricians talking about getting the kids back into school. Now, originally, the school was to start, it was to start on the 3rd of January. They extended it to the 5th. Why they did like a 2-day thing, I have no idea. Thinking that it's going to be enough for the kids to, and the teachers, whatever, to be prepared. And then doing an about face and then saying, no, schools are not going to go back in until at least the 17th of January. And that's in basically in the same breath, the government, resorting us back to, basically like a stage 2 reopening again, because, we didn't close all of the non-essential businesses. What we did close here was we closed the gyms, we closed the movie theaters, we reduced capacity for sporting events that held over 1,000 people. So that was reduced only to 1,000 people for sporting events. Capacity limits in grocery stores, capacity limits in the shopping malls and other non-essential businesses. Recreational sports, they have been canceled as well. And all we've seen, even like the onset of the holidays, like just before Christmas, we've seen these increases of cases. And, it's really going across the board here. I mean, it's going through every sector that you can imagine. Every workforce out there, it doesn't matter, it's leaving shortages of staff. The government talked about having priority spots available for teachers who have yet to still be vaccinated. And I don't know why that case is, why even, teachers still not vaccinated, or they've had their first dose, or they're looking to get their second dose, or they're looking to get their booster, whatever the case may be. So they're opening, so prioritizing the teachers, to get in there, get vaccinated, do what you got to do, you know. Um, and then, as I was reading another article, with the Toronto Transit Commission. Over the course of time leading up, some from November, throughout November, given their employees ample time to get vaccinated because they mandated this as a policy in the Toronto Transit Commission. And so far, it's been something like over 300 people have been let go from those services because they, failed to show their status or not vaccinated and have been fired. Now, there's been this discussion been going on for some time, with employers mandating this, and mostly it's been corporations. And even the federal government here in Canada mandating that truckers be fully vaccinated in order to cross back and forth the land borders between Canada and the United States. And that leaves a huge question, will people, who are, losing their jobs because they're not following the mandated regulations put out by the corporations or businesses, will they get employment insurance? Will they get severance pay? These sort of things are slowly going through the court system. And it's going to take some time in order before we even get an answer back from the courts here in Ontario, even if it goes as far as the Supreme Court of Canada. We're going to be lagging and waiting for that to any ruling to come down for that. Now, I guess during this meeting between the federal government and the provincial leaders here across Canada, and like here in Ontario specifically, because every province had set up their own school closures and when they're going to return. British Columbia returned their kids back to school today. And so here in Ontario, the Ontario government is saying that the schools will reopen for in-person learning on January the 17th. Now, like I said, like in the schools, the province were set to return on the 3rd, but the government initially delayed the return to classrooms to January the 5th, and claiming that 2 extra days would give schools time to provide masks to staff and deploy, 3,000 more HEPA filter units. 2 days. I mean, you know how many schools we have in this province? The 2 days would never have done it in the first place. And then, like I said, doing about face to say, well, no, we're going to keep the schools closed until the 17th of January. Now, the other part of the decision is that we, was made amid the surging COVID cases fueled by the Omicron variant, which has seen hospitals faced with higher than unusual patient volumes and staff shortages. And that's what we're facing right now. I was reading an article earlier, just on the weekend, hospital in Toronto, the emergency service was without 50 ambulances because they're tied up at the hospitals, sitting with the patients, waiting to be seen. We can't have this sort of disruptions. We can't. Shortage of nurses, shortage of doctors, people who have to self-isolate or have come down with COVID in the healthcare profession, not just here in Ontario, right across the entire country. We're seeing it in all sectors. Friday just passed. I went for a PCR test. I got my results back yesterday from the London Health Science Center. I tested positive for COVID. Last week, so, like the 3rd, so I lived with 2 other people in the house. On the 3rd, one test positive. I was supposed to be going back to work by that time. We had the Monday off. So one member tests positive. That means I got to isolate. I did a rapid test on Wednesday. I tested negative. The next day, another member in the household does a rapid test and tests positive. That was the Thursday. I call the health unit on Friday and tell them my predicament. Look, this is the situation that I'm in. And the only way and the only reason why I could get a PCR test is because I'm an essential caregiver. Send me for the PCR test Friday afternoon. I get my test results back yesterday and I test positive for COVID. Now, I've been off work since the 31st of December. I had the 31st off. That's New Year's. Of course, then the weekend, Saturday, Sunday. I had the Monday as well, so I got a 4-day weekend. Returned back to work, Tuesday just passed. And here I'm still home. And today's the 10th. And I got my test results back yesterday. I tested positive for COVID. I haven't gone anywhere. Now, hopefully, the health unit, if they're, is said in the test results that somebody from the health unit will contact me within a couple days. So I don't expect that to happen until Wednesday. I could just imagine how many people, they got to contact. Maybe we, just here in the city that, we're not getting a lot of cases that they can at least, keep up with the phone calls with people who have tested positive. The other problem that we're running into is with the rapid tests is they have that false positive. Now, I may have gotten that on the Wednesday when I tested with the rapid test. Because even on Wednesday, I had a really sore throat, somewhat of a cough, and congested. and I get a negative test, and then able to get the PCR test at the COVID testing site and test positive. I mean, I feel pretty good. You know, my symptoms weren't like a lot of people that were experiencing headaches and fever and muscle aches and chills. You know, all that stuff here. Just, you know, a sore throat and a cough and just really congested. You know, those were my symptoms. So I don't expect to be, you know, back. I mean, if they turn around and they say to me, well, the day of the test, you know, because I've already been, you know, from Monday to the Friday, so I was already isolating 5 days because, you know, they shortened it from 10 days to 5 days, so I already did self isolation because someone tested positive, then someone else tested positive in the household, so I'm already isolating. So, like I said, I go for my PCR test on the Friday, you know, unknowingly, but we can actually, you know, say I was already infected. So, does my isolation period start from Friday? We go Saturday, Sunday, Monday, Tuesday, Wednesday as 5 days? Or when I got my test results back yesterday that I was positive, do I go 5 days from yesterday? So being Monday, Tuesday, Wednesday, Thursday, it will bring me to Friday. Or when is it they can get me back in for another test so I can test negative? Even though as the days goes on and I start feeling better, doesn't mean that I'm clear of the virus. I gotta have a negative test. And so with the shortages of staff everywhere, you know, and you know, with people, you know, with these special interest groups, you know, calling out the government and saying, look, you know, the kids have to go back to school on 17th. Because the other measures put in place go run until the 21st of January. That's with, you know, capacity limits. And, you know, like I said, we closed our, like the recreational sports, we closed the gyms, we closed the movie theaters, um, uh, reduced capacity limits everywhere. So right now, because, you know, and it's right across the board here in Canada, every single province, it doesn't matter. Like, you know, today I could read that we have 10,000 cases. We have 2,500 people in hospital, 450 in ICU. The general population, you know, and like I said yesterday on my show, is that the only people that can get a PCR test is people that work in the medical field, people that work in nursing homes and retirement homes, people who are essential caregivers. The rest of the general population cannot get a PCR test. They're gonna have to rely on the rapid test. We can't count the general population and how many cases we've got out there. And how many people are going to get a false positive using the rapid test? And then I was reading an article today, one of the best in the province of a disease infectious doctor, even suggests doing a throat swab with the rapid test, and more than likely, you're gonna get the test result you don't want. So people out there, even around the world, I'm sure with the rapid tests that you have, or you've used them, and maybe you got a false positive, and you have a sore throat, and you have a cough, and you have congestion. Those are my symptoms, and I test positive. And maybe you tested negative on the rapid test. Try a throat swab and do the test again if you have another rapid test that you have hands on, that you have access to. So we have no way of knowing how many cases we actually have here just in the province of Ontario. But we do know when they say we got 10,000 cases, that's from the PCR test. So, like I said, with the general population, we have no idea how many cases are out there. People, during this time of year, pre-pandemic, I mean, it's just like, it's winter time. We get the common cold. I mean, it's even flu season, by the way. But that's irrelevant because we haven't even acknowledged or anybody's even been, found to have the flu. So, how many people, are walking amongst us, um, even just with the symptoms I had. If we didn't have our hands on a rapid test just Monday that passed, even though some in the household felt like shit, and we had no way of testing, I would have been going to work and I was infected, not even knowing it. It was very fortunate that we got our hands on a rapid test, and somebody test positive in the household. I mean, I could have been gone to work all this week. I'm a city driver, and I was infected. So how many more people out there, who, the government says, we got 140 million rapid tests that we're going to send out across all 10 provinces in three territories, throughout this month of January. And the only reason why we got our hands on one is because when the school broke for Christmas break, kids got a rapid test. So if you had 2 kids in your family or you had 3 kids in your family, each kid got sent home with a rapid test. So my daughter had an extra one. That's the only reason, we found out that somebody's positive in the household. It shouldn't be this difficult to get your hands on a rapid test in this country. This is fucking ridiculous. The United Kingdom sends out rapid tests to every single household. In Canada, a population of 37 million people and stuff like that, you got 140 million test kits that you can send out, and they're just going to just drop them on the doorsteps of each provinces, and the province is going to decide when they're going to send them out. It's ridiculous. So I can't even imagine how many people going to the shopping malls, going to work, not having access to a rapid test, not having access to a PCR test because they don't fall in the category to get a PCR test. And they're walking around with a sore throat, coughing, stuffiness. Have the coronavirus and not even thinking about that's what it is because, you know, three symptoms: sore throat, cough, runny nose. Three symptoms. We want to thunk it. And those are my symptoms. That's what I have. My throat is not as sore as it's been, but it is still sore. You know, what they go by now, ladies and gentlemen, is what they're counting, with the PCR test. And the most important numbers that they're counting is how many people are in hospital and how many people are in the ICU. That's what we're doing here in Canada. And of course, like other countries, um, with the United States and Canada and maybe even Europe is going to start to do this. Maybe they're doing it already. I don't know, but the isolation time cut in half. For fully vaccinated people who come down with COVID from 10 days to 5 days. Right, and that is just a guideline. I mean, don't chalk it up as saying, "Oh, my 5 days are up, and yeah, I still got a sore throat and runny nose and stuff like that. Oh, I can go out now because it's my 5 days isolation." You got to get tested. You got to test negative. So people, I mean, if you get the, if I mean, if you don't understand, the rules when they say a 5 day isolation for people who are fully vaccinated, just because those 5 days are up and you still have a sore throat and stuffiness, that doesn't mean that you're clear. You have to test negative. Anybody who's unvaccinated has got to self isolate for 10 days. And they have to get tested. And then the so when the prime minister in all of the territories in all the three territories and 10 provinces here in Canada, the government getting together and talking about um, what's our next step, here in Canada of getting things moving, so we can um, get going here, and get out of this mess, So um, I don't know what to tell you because, we had the top minister, uh, health minister here in Ontario. He was talking the other day well, the health minister was, I don't know what you call him. Well, he's a health minister in the federal government that, you know, he was talking about mandating vaccines. Meaning making it law. I mean, in the education system here in Canada, every child, you know, beginning of their vaccines at, you know, I think it's like 3 months and 6 months, and then a year, and then, whatever, maybe 2 years old, all have to be vaccinated, you know, before they even start school. I mean, mandating it on the general public, isn't going to work. But if they mandate this into the educational system, as they did for smallpox and polio, and for measles and mumps and chickenpox, etc., these vaccines, it would be virtually impossible for the government to mandate it on the general population. It just would not even happen. Because right now, you have a choice. You have a choice either to get vaccinated or not. And if you work for big corporations who have mandated vaccines in the corporations that you are to be vaccinated or face losing your job, that's your choice. I mean, why would you want to give up a good paying job if you have a good paying job? The Toronto Transit Commission, the bus drivers in the city of Toronto, make $35 to $40 an hour. Why would you risk that? Why would you not get vaccinated to keep your job? And you go work for $15 an hour because that's what the minimum wage here is. Maybe you're in a position that you can retire, so it doesn't matter. To pay out your retirement package or whatever like that, and send you pack and see you later. You know, so with extending the school year too, they're talking about that. These 2 weeks will provide much needed time for more vaccines and boosters. Well, people are waiting for that. People are waiting for their boosters. The other problem here, ladies and gentlemen, this is so ridiculous. People booking appointments for their booster, showing up for their appointment time, and finding out they're getting the Moderna vaccine for their booster. They walk out. Oh, I got Pfizer. I got Pfizer for my 2 shots. I don't want Moderna for my booster. I want Pfizer. The government turned around and made the Pfizer available for the most vulnerable for boosters. So people who, you know, are, you know, in their 80s and 70s and that living at home, and for people who are in nursing homes and retirement homes, ages from 5 to 17 is what they're using the Pfizer for. When I got my first 2 doses, it was Pfizer. And then when I became eligible for the booster, which I got on the 24th of December, I knew going in that it was going to be the Moderna for the booster. And that's what I got. I'm not picky, ladies and gentlemen. I want to protect myself, and I want to protect my family. So these people who are bitching and complaining that they're going to get the Moderna as their booster and even as their first dose of the vaccine, because they've been sitting on the fence for too goddamn long, trying to make up their mind whether they're going to get vaccinated or not. Never mind the anti-vaxxers. To find out, oh, I guess, I'm going to decide I'm going to get my vaccine now. This is, this Omicron is spreading like wildfire now. So I'm going to go get my first shot. It's going to be Moderna. Your second shot's going to be Moderna. Your booster's going to be Moderna. If you don't like it, then maybe 3 months ago you should have got vaccinated. You would have got Pfizer. If that's what you want. Beggars can't be choosers. So now you made an appointment that has been so hard for so many people to make appointments, and then you just cancel it just like that? And people are waiting to get in to get their boosters? But you're holding up the spot until you get there to find out that you're going to get Moderna, and then you just walk out? That's ridiculous. That is nothing but childish. Unbelievable. When I was reading that article, it's just unbelievable. It is so childish that people are actually doing that, and people are waiting to book appointments to get in there, to get their vaccinations, to get their boosters, and then these morons who book appointments go find out they're going to get a Moderna for a shot, and they walk out. Unbelievable. Absolutely unbelievable. I never seen anything like it. It's just absolutely freaking stupid. And you want your kids back in school on January the 17th? Roll up your sleeve and get your goddamn shot. It's unbelievable. It's just, it just really ticks me off. And you know what else is going on here too? Just in the general public, and in surveys, people like myself and probably like you have just been growing more frustrated with the unvaccinated. Whether you're hesitant still or you're an anti-vaccines, our patients are running thin. And I don't know, what goes through people's minds. I don't know what they think, who the healthcare professionals are. Who do you think nurses are? Who do you think they are? They're people. They're human beings that has been on the front lines from day one trying to save lives. And the pressure that is being applied to them in the burnout rate is just unspeakable. Oh, it's okay. They're just nurses. They'll be there for us. Who gives a shit, right? You know, they got some special shield around them that they can't get infected or something like that, right? Oh, no, this virus will never affect a nurse because she's powerful. You know, she's got this wand that he or she just, when they get into the hospital, they just put this magic wand around them and it creates this shield that, oh God, never worry about them. They're not going to get sick. They're not going to get burnt out. They're not going to get tired. We'll just keep throwing the pressure on them and they're going to take it. The fuck is wrong with people? Patients are growing thin with people who aren't vaccinated in the anti-vaxxers. It's unbelievable. Absolutely unbelievable. And they'll be the ones to first and bitch and complain because not only is it hospital staff, the paramedics. You can't get an ambulance fast enough. Oh, I'm unvaccinated. I'm sick. I've got coronavirus. I have to go to the hospital. Well, the ambulance is going to be about 3 hours, so, we can't get to you right now. Imagine that. We need our paramedics, we need our ambulances on the road for real emergencies. As far as I'm concerned, people who are unvaccinated, the anti-vaxxers out there, you're not a real emergency. And the anti-vaxxers are just childish and pathetic. If you lose your job because you work for a corporation that's mandated and you want to get vaccinated, well, that's your damn problem. Frustration is mounting against with the general public, with the people who are vaccinated. We're just sick and tired of the bitching and complaining and the frickin' whining from these anti-vaxxers out there. We're just sick and tired of your bullshit. There are more people in the hospital unvaccinated than there are vaccinated. Because you're spreading the goddamn shit. You're like a farm manure spreader is who these anti-vaxxers are. You're just spreading this like shit everywhere. It only takes one person, ladies and gentlemen. One person to be infected and spread it. Everybody in this household where I reside is vaccinated. What's keeping us out of the hospital so far is being vaccinated. Nobody's immune system is the same. Nobody has the same immunity levels at all, even if you're vaccinated. And vaccinated people are still ending up in the hospital. And with complications from COVID, because they don't have a strong immune system, or they have other underlying conditions, and COVID isn't helping. We're not invincible, people. We're just not. It's just astonishing, and it's amazing that we can even survive on this planet. With disease and natural disasters and so on, that we even survive. I don't know what to tell you. I really don't. But, like I say, um, I can consider myself lucky because, you know, I didn't get all those other symptoms. But a person in this household did. Headache, fever, body aches, chills, sore throat, fully vaccinated. And I get a cough, a sore throat, and nasal congestion. Those are my symptoms. And I test positive. Now I got to wait to see when I test negative. It's just like, when you get the common cold, right? Never mind the pandemic for a moment. You get the common cold, you get a sore throat and stuff, and it just carries on. It's just something that just doesn't want to go away. You take lozenges, or you take cough medicine, and you go to work, and it just goes on 5 days. You still got this cough and stuffiness and all that stuff. The common cold can just carry on for like 10 days. So um, so I said, before I can return to work, I gotta have a negative test. I mean, I can't assume after the 5 day isolation, because I'm fully vaccinated. I can't assume that I'm clear. Because if they back it up to Friday when I went for the test, so they got Saturday, Sunday, Monday, Tuesday, Wednesday. So if I still have a sore throat and stuffiness, then I'm not out of the woods. That basically has to be cleared up. You know, and then we have when I talked about the city of Toronto when it came to for the paramedics. So on the upwards of 50 ambulances were tied up at a Toronto hospitals this weekend when a code red was issued. 50 ambulances tied up at all the hospitals around the city of Toronto. Because the paramedics, when they bring you to the hospital, they got to wait. Once the staging area gets full, a couple ambulances, you still got to wait. The paramedics have to stay with the patient because the doctors and nurses are dealing with other patients. They talk about in more typical times, around 40 Toronto ambulances are usually available to respond to calls at any point, according to the city spokesperson. You got 50 ambulances taken out of service because they got to sit and wait with the patient. Even if they're not offloaded from the ambulance, they're still going to be attended to by the paramedic. It's ridiculous that this should even be happening. I mentioned last night that, people around the world think, oh, yeah, Canada's got a great healthcare system, universal healthcare. It's beautiful. It's wonderful. This is bullshit. We see how this pandemic has affected this healthcare system. It's hanging on by a piece of thread. If our healthcare system in this country was so great, then we wouldn't have to cancel elective surgeries. We wouldn't have to cancel minor surgeries, even with a pandemic going on. People would still be able to get these surgeries. But oh no, we canceled all that. COVID-19 patients are taking up the wards. They're taking up the ICUs. The only thing that we got going for us right now with our healthcare system in this country is that, I don't have to pay to see a doctor. I don't have to go pay and get treatment. And what a universal healthcare system means is that our healthcare system is paid by our tax dollars. It's not free. Nothing's free. We pay for it here. Just, not like they do in the United States, where you have to buy your health care. And people in the United States, there's a lot of people in the United States can't even afford to do that. Because they don't understand universal health care in the United States. They don't understand that. I hear you have a copay. You have to have a copay, to see a doctor. And even if you have health insurance, well, you got to pay your doctor $50 just to sit down in a chair in front of him and talk to him. That's ridiculous. But our healthcare isn't as great as people think it is. It just isn't. We just take it for granted, is what we do as Canadians. We just take our healthcare system for granted. We will survive it. But it just goes to show you, it opens up all the cracks in the healthcare system in this country. And the federal government and the provincial government better fix it. Over the decades, from levels of government, whether it was the Liberal Party who was the leader, or the Conservative Party, or the NDP Party, they have their caucus, they have their educational ministers, they have their health ministers, and these health ministers are in charge of the health care. And what they've done over the decades of hack and slash our healthcare system, all this shit. Not giving enough funding to the hospitals and say, you have $1 to manage your affairs. Basically, you might as well say that's what they've given them. And the cutbacks. It's just ridiculous. One of the wealthiest countries in the world. And we just have people that think they just do as they please with our money and hack and slash services. And then when something like this happens, unforeseen, a pandemic happen, and then you see how fragile the healthcare system in Canada is. How fragile it really is. Yeah, we have great doctors here. We have great specialists here. Great nurses here. But they can only help you if we have the availability, that we have the capacity. And where we have to call in the military, special services from our military to come in to help in hospitals. They're going out to the most rural areas in this country, in the 3 territories, because they don't have the staff, they don't have the availability, they don't have the full services that we have in these large cities. And they're even helping out even in some of the large cities because staff shortages, because people are coming down with COVID and they got to self-isolate. The province of Quebec is calling back their nurses earlier than the 5 days of isolation to work because they can't keep up with it with the staff they have. So they're going to call back people who are infected to come back into the hospitals. How the hell is that going to work? I don't know what the hell is wrong with the province of Quebec. They operate like they're their own country. They honestly do. They make up their own frickin' laws. For an example, when it comes to people who come from, like the Middle East or whatever like that, where people, where they wear turbans or whatever head coverings the women wear, from that culture. If they work in a government facility, they can't wear that, according to the Quebec government. totally going against their beliefs or their religions. Totally against it. This is the province of Quebec's government. This is what they do. But calling back staff who's not even been isolating for 5 days or whatever the case may be, and calling them back because they got a shortage of staff. It doesn't even make sense. We'll just call back the infected people and we'll just infect more people. Brilliant. Just freaking brilliant idea. I wish I would have thought of that. I'd give myself a pat on the back because I'm a politician. Unbelievable. I've never seen anything so stupid in my life. Besides people who walking away from getting their vaccines because it's a Moderna. I mean, that's just right up there. How stupid that is. Oh, I'm not getting the Pfizer shot. Well, I guess nah, I don't want it. That's ridiculous. It's like you can't wear a turban, you can't wear your head coverings as a woman in the province of Quebec, the only province in this entire country of Canada, the only province is doing that people who work in public government, police services, whatever, they can't wear that. It's being challenged. It's going to be taken to the Supreme Court of Canada. And I hope the government of Quebec gets their ass handed to them for preventing people, doesn't matter where you're from or whatever your religion beliefs are. If you wear a turban or any other head coverings, you should be allowed to do that. You're allowed anywhere else in Canada to do that, but not the province of Quebec. God forbid. It's ridiculous. See how that pans out for them. We'll see how this pans out for them. We're calling back nurses who are on leave because they have to isolate or they're infected. They're calling them back to work because they have a shortage. That doesn't even make sense. In the province of Quebec, that's what's happening. I don't know what to tell you, man. I mean, we can, the shortage of nurses, even pre-pandemic, you know, we've always seen that, but not at this magnitude, but shortage of nurses by any means. People leaving the profession, retirement, people leaving the profession, because of pay, or whatever the cases may be, and not enough nurses coming into the field. So, like I say, when we have an unforeseen situation that the world finds themselves in right now, should be an eye opener for everybody, no matter where you are in this world, about your healthcare system in the country where you reside. And what's it like? How's it been, since the pandemic? And look back what it was like pre-pandemic. things have gotten a lot worse. When it starts to affect not just, hospitals, affecting paramedics, affecting police, affecting fire departments, you think these people don't get sick? You think these people won't get sick? They're getting sick. I can't tell you what to do, ladies and gentlemen. You have to make up your own mind. You got to make your own decisions. I mean, if you're not vaccinated, get vaccinated. That's up to you, though. I can just ask you to do just that. To all my fellow Canadians, do the same thing. I can only ask you to get vaccinated. It's up to you. It's a decision that people are going to have to make. Yeah, hopefully, we start seeing numbers starting to come down, by mid-January, maybe the end of January. We start these things start to level out, start to drop. I don't think the government here in Ontario is going to really make much changes on January 21st if we're still seeing these high numbers in the hospital and in the ICUs, that they'll extend these restrictions for another 2 to 3 weeks if we don't start to see a decline in hospitalizations. But they're going to put the kids back in school on the 17th of January. I hope it works out. I really do. And if we have to close the schools at the end of January, for an example, who are we going to blame? We're going to point the finger at the government because you said that you were going to make the return to school safe. And you've said this throughout this entire pandemic, and the schools have been out. Last year, when they did not return from the March break, what's going to happen this time? I guess we're going to wait and find out. So thank you for joining me this evening, ladies and gentlemen, coming here on the Truckers Podcast. It's always a pleasure to have you come out here and, listen to me sometimes bitch and complain about things, because if we don't, then we're not human, right? I'm sure you do the same thing. So I thank you for coming out here and listening, and hope you can join me again. And it's getting really snowy out there this evening and getting quite cold. So hopefully, this, I wouldn't call it a storm, just a system moving through the area here. Hopefully it passes and it doesn't affect the internet like it has in the past. And have another show tomorrow, because what is today? Gosh, is it Monday? Yeah, Monday. So I'm going to be here tomorrow, Tuesday, Wednesday. I'm going to be home until I get the all clear to go back to work. So hopefully, hopefully that comes soon. I really do. So, but in the meantime, yeah, I got lots of time on my hands because I can't go anywhere because I have to isolate. So come out here and talk to you and enjoy what I like doing. That's why I started doing this podcast. 2 years ago, starting to do this. Actually, yeah, it is. It was like, yeah, it was January 20. Yeah, January 2020. Like January the 3rd of 2020 is when I started doing the show. So it puts me up to like almost like 300. I don't know what it is now, 315 episodes, something like 310 hours. Yeah, I mean, I enjoy doing this, and I enjoy your company. I really do. So I will be back out again. There is a couple other stories on here that I didn't get to, and stuff like that. So we'll get to those hopefully tomorrow. I tried to do it in the morning. And I tried to do one this morning, but I was up a lot last night, and my throat was like still sore this morning. It feels a little bit better this evening. That's why I decided to do a show. So hopefully, it always seems like nighttime when you just start to feel, more lousy again. It's like when even just with the common cold, you feel more stuffed up at nighttime than you do during the daytime. So, in morning time. So hopefully, I can, do a morning show. I would like to put a time up on that, but, I can't guarantee, if I can, say if I started at 1 at 10 o'clock in the morning, say, hey, I'm going to start 1 at 10 o'clock in the morning, that's when I feel, at nighttime and in the mornings, that's when I feel the worst. That as the day, goes on, I feel better, but I'm not better. I'm getting there though. But but I'll just, I did post one up tonight because, it was like, what time was it? Like 9:15. So I give myself 45 minutes. I already had a couple of topics up here that I wanted to talk about anyways. So, I thought, I want to get a show out here, before I go to bed and stuff like that. So, because it is right now, 11:15 p.m. here in Ontario, Canada. So, I do want to get back out tomorrow morning, but what I think I'm going to do is that I'm going to put the show up for 11 a.m. and that, I get up early anyways, and just time to chill out, have, some warm liquids, coffee, tea, or something like that to help soothe the throat, and get out here and do another show. So thank you for joining me again, and enjoy the rest of your evening, or if it's, already tomorrow, and wherever you are in the world, enjoy your day, and thank you. This is the Truckers Podcast. I am your host, Doug, from Ontario, Canada. Take care, and thank you.